Hello everyone, I'm Dr. TWENEBOAH and welcome to this episode of Educate Me. In this episode, we shall discuss a very important health topic, infertility. Most people will have a strong desire to conceive a child at some point in their lifetime, and society places a great deal of importance to that. About 85% of couples will conceive in the first year of marriage after regular, unprotected sexual intercourse. Infertility, as defined by the World Health Organization, is the inability of a couple to conceive after a year of regular, unprotected sexual intercourse. Every couple can have a child by one means or the other. As such, the term subfertility is preferred. Infertility may be primary or secondary. Primary infertility is when a couple has never had a child. Secondary infertility is when a couple have had previous pregnancies but have difficulties with subsequent ones. Infertility is a shared problem of both men and women. In order to appreciate the causes of infertility, it is first of all important to understand how normal pregnancy occurs. For a normal pregnancy to occur, 1. A woman must ovulate regularly. That means she should be able to release eggs on a monthly basis. 2. She should have patent and functional fallopian tubes. These are structures that convey the fertilized egg to the womb for pregnancy to continue. 3. The woman should have a normal structure of the uterus or the womb. This is where the developing baby grows. 4. There should be regular unprotected sexual intercourse. And by this I mean a minimum of 3 to 4 times in a week on different occasions. The truth is that whenever a woman ovulates, the egg has up to about 24 hours within which it must be fertilized by a sperm for pregnancy to occur. If this process is unsuccessful, then the couple will have a chance at the next ovulation, which will be in a month's time. So, frequent unprotected sexual intercourse is key to conception. 5. There should be normal semen parameters in terms of sperm quantity and quality. Even though some couples may meet the criteria explained above, approximately only 1 in 4 may conceive in a month. So the process of conception to some extent is based on probability or chance, and couples must understand this. So the causes of infertility can be grouped into female factors and male factors. For female factors, there may be problems with ovulation. That is, the woman may have issues releasing eggs every month. This may be due to hormonal imbalances. There may also be issues with the fallopian tubes, and this typically arises from untreated or partially treated STIs. Some women may also have issues with the womb or the uterus. Male factors typically include problems with the semen quality and the quantity. For some men, the problem is with the quantity. They may have reduced number of sperms, a condition known as oligospermia, or there may be no sperms at all in the semen, and that is known as azoospermia. There may also be abnormal forms of the sperm, so they are not able to travel effectively to fertilize the ovum or egg. You may have to see your obstetrician and gynecologist together with your partner. This requires a lot of commitment and patience from both partners. Your doctor may take you through a series of investigations in an attempt to find the cause and possibly tackle it. Now, the treatment options. Education. For some couples, they only require knowledge on proper timing and frequency of sexual intercourse in order to achieve conception. There's also a process known as artificial insemination, where the male sperms are harvested, washed, and then the healthy sperms directly introduced into the woman's womb. This increases the chance of conception. You might have heard of in vitro fertilization. This is a technique whereby the woman's eggs are fertilized outside the womb by sperms in a lab, and then the fertilized ovum is transferred back into the uterus. There are several modifications to this procedure. Another option is surrogacy, where another woman bears a child for a couple. If these options fail, then we may resort to adoption. Infertility poses a big challenge for couples. and may even strain relationships. But as we've learned from this presentation, there is help. Thanks for watching. I'm Dr. HUMPHREY, TWENEBOAH. Please like and share this video with other friends.